Okay, Howard Hewett.
What's
So
up?
tell me the history of your pain here for the plantar fasciitis that you've been dealing with.
Well, if I'm not mistaken, I think I started feeling it like about 4 years or so ago, 4 or 5 years or so ago, and it was like a work-related thing where I stepped off of a
Right, I remember you telling me that.
off of a stage, of a lower part of the stage, and stepped on it, and it just, I mean, the pain. The next day I was hobbling.
Right.
And so I came back home, of course, went to a foot doctor, you know. He told me I had, it was like plantar fasciitis, whatever it is.
Yeah, fasciitis.
Fasciitis.
Right.
And he made me an orthotic, a pair for my shoes and stuff. And so I did that for a while, and then the heel pain didn't start, I think, until like about maybe a couple years later.
Okay.
So actually that was about maybe 2 years ago. And the heel, it started, but it would hurt, and then it would go away for a minute, and then it started hurting again, and the more times it would hurt, the longer it would stay before it went away.
Right.
And finally it was just hurting all the time. I mean, I do a lot of airports. I'm in and out of airports all the time, every weekend basically. And you know, international travel, so it's a lot of walking. And I mean, there were times when if I would miss something, you know, like a Starbucks, and it was down that corridor and I didn't know it was down a certain corridor, and I had walked this way, I had to really, you know, think in my mind, do I really want that coffee, you know, that bad to have to turn around and walk back and walk down the thing, because it just hurts. It would hurt so bad. And that's the history of it.
Yeah. So you had orthotics. You ended up getting cortisone
shots,
and then physical therapy.
Everything.
And it helped how much, would you say?
Not hardly.
Not hardly anything.
I would get foot massages and stuff, and it would feel good when I you know, left, but within 15, 20 minutes, half an hour, the pain would still be there. And it would even be worse, like when if I'm driving somewhere, and I've been driving for about 15 minutes, 20 minutes, and I initially get out of the car and start walking, man, it was like killer. It was excruciating. It was seriously bad pain.
Right. So then the next step was my recommendation for you to get the platelet injections, right?
Yes.
So
Yes.
So tell me, you know, how it felt, you know, the procedure of getting the injection. Of course, we drew your blood and spinned it, and then the procedure.
Like 35 cc's or something like that.
Right, pulled out,
which sounded like a lot.
Yeah, 35 cc's of blood, and then spinned it, and we got like
spin
3 cc's of the platelets.
Platelets.
So how did it feel when you got the shot?
When I got the shot, you had numbed everything up,
right.
you know, for one thing. So it was difficult to see whatever. But when I first got the shot, it wasn't painful. I mean, I'm pretty much, I have a pretty high tolerance to pain and stuff. So, but it wasn't really painful. You dead in the area, shot it in a couple different places, and when I really started feeling it was when the numbness started wearing off later on.
Right.
And man, I felt a difference then. The pain had eased up.
Okay.
Then, you know, and so, like, you know, you had said, well, it's gonna take, you know, 2 weeks or whatever to feel any kind of improvement.
Right.
And so when I felt that, I was like, well, maybe it's just my imagination or something. So I'm waiting for the pain to come back in full blast like it had before.
Yeah, because you're so used to that.
Yeah,
right?
so used. But it never came back like that. And it started, and then after a couple of weeks, I came back and you said, well, how does it feel? I said, man, it feels great, you know. And then he said, well, it's only been 2 weeks, so it can only get better.
Right.
So that was encouraging. I dug that, you know. So.
Right, and then I took an image, and then your heel looked a lot better with the ultrasound.
Yep.
So we knew that you were better, and then so today, you know, I think this is a few months now since the procedure. How are you feeling?
Feels great.
Yeah.
Feels great. I mean, I like I said, I'll feel certain things or whatever, but I think that's just my foot because I
Right.
still have to. I have to wear my orthotics.
Right. So you were
Yeah.
saying like when you don't wear
Yeah.
your orthotics, and sometimes you might
Yeah,
feel a
'cause
little
I'm-
something,
'cause
but it's
I'm
not.
flat-footed. I've been flat-footed
Right.
all my life. you know,
Right.
So,
Right.
so when the one time that the initial pain that I felt 4 or 5 years ago, when my left foot started really giving me problems, I think was even more little of that arch. What little bit of arch I have, I have left kind of dropped a little bit more.
Yep.
So then I think that brought on all the other stuff, all the other problems.
Yeah.
So.
You're right.
You know, so like, the orthotics are very important to me now.
Exactly. Yeah. To prevent any issues in the future. So then, so you would recommend this to other people then?
Man, to anybody, everybody. I mean, I've always, the whole stem cell platelet situation has always been something that's been real interesting to me anyway. I'm glad that it's been opened up the way that it's been opened up, because I believe that that's, the medicine, the medical situation of the future.
Yep, you're right.
Yeah.
Absolutely. Well,
Yeah.
I'm glad to see that you're feeling 100% and you're feeling a lot
Yeah.
better. Awesome.